hemorrhagic fever transmitted by infected mosquitoes. The species of mosquito which transmits yellow fever is the Aedes aegypti, and it is most active during daytime. The infection in its early stages presents as fever, malaise, and is followed by jaundice, that is the yellowing of the eyes, from which the infection gets its name. This usually happens within 2 weeks of the onset of infection. One positive case of yellow fever is considered an epidemic. In response to repeated outbreaks around the world, the World Health Organization launched the I strategy, Eliminate Yellow Fever Epidemics strategy, in April of 2018 in Nigeria. It aims to achieve yellow fever elimination in phases by 2026. This is a follow-up of the 67th session of the WHO Regional Committee meeting for Africa Health in Zimbabwe last year. This meeting adopted the framework for implementing the global strategy to eliminate yellow fever epidemics from 2017 to 2026 in the African region. The strategy also aims at building a global coalition of countries and partners to tackle the increased risk of yellow fever epidemics in a coordinated manner. The goal of the yellow fever preventive mass vaccination campaign is to reduce yellow fever transmission by achieving 90% coverage in implementing states and local government areas, in line with the strategy for elimination of yellow fever epidemics. Nigeria, being a yellow fever endemic country and a top priority in WHO's global control efforts, has received considerable attention, focus, and support from international development partners, namely WHO, UNICEF, the Global Alliance for Vaccines and Immunizations, Gavi, US CDC, and donors, particularly following the outbreak of yellow fever in Nigeria last year. It has also become more critical following the evolving epidemiology that has resulted in the occurrence of confirmed outbreaks in previously non-high-risk states. The 3 strategic objectives of the I strategy are: 1, to protect all at-risk populations; 2, prevent international spread; 3, contain outbreaks rapidly. In order to protect at-risk population, this will involve preventive mass vaccination campaigns, vaccinating every child through the routine immunization program, and doing regular risk assessments. To prevent international spread, we have to continue to protect high-risk workers, apply the international health regulations, and build resilient urban centers. To contain outbreaks rapidly, we have to strengthen surveillance and laboratory capacity. We have to ensure emergency stockpile of yellow fever vaccines and ensure immediate outbreak response. Nigeria is one of the endemic countries for yellow fever. We introduced the vaccine into the routine immunization schedule in 2004 for children aged 9 months. Nigeria also provides immunization for all travelers at the Port Health. In 2008, the federal government of Nigeria, through the Federal Ministry of Health, the National Primary Healthcare Development Agency, and development partners, developed a yellow fever risk assessment, which identified 21 states as high risk for yellow fever transmission. The country received Gavi support to carry out phased preventive vaccination campaigns in those high-risk states from 2013 to 2017. However, we were unable to complete the vaccination plan due to global yellow fever vaccine shortage that was worsened by the 2016 yellow fever outbreak in Angola and the DRC. In the first phase of the Nigerian campaign in 2014, only 3 states, Akwa Ibom, Cross River, and Nasarawa, out of the 36 states and the FCT, conducted mass vaccination campaigns. The post-campaign coverage results were 59% for Akwa Ibom, 84% for Cross River, and 91% for Nasarawa State. The country has been experiencing sporadic outbreaks of yellow fever since September 12, 2017, when the first case was confirmed in a 7-year-old child from Ifelodun, LGA, Kwara State. Currently, there are over 1,600 suspected cases listed, with 41 confirmed from the WHO Regional Reference Laboratory in Dakar, Senegal. However, the federal government of Nigeria, through the Federal Ministry of Health, NPHCDA, and the National Center for Disease Control, collaborating with development partners, mounted a combined outbreak and preventive campaigns in Kogi, Kwara, Zamfara, Kebbi, Niger, and Borno states. These campaigns were very successful in addressing the outbreaks since September of last year. The second phase of the preventive campaigns were carried out in January, February of this year, in which over 8.6 million people aged 9 months to 44 years were immunized. The post-campaign coverage survey showed 93% coverage for Kwara, 94% for Kogi, 87% for Zamfara, and 96% for Borno State. This included the camps for internally displaced persons. The federal government of Nigeria, on its own part, is committed to establishing a reference laboratory in the country to reduce the logistics challenges with sample transportation and laboratory turnaround time that occurs when these samples are taken to Dakar, Senegal. This will ultimately reduce the response time and consequently the morbidity and mortality rates from yellow fever. Currently, there is an ongoing third preventive mass vaccination campaign with a target age group of 9 months to 44 years in Sokoto, the Federal Capital Territory, Niger, Kebbi, and Plateau states. The vaccination campaign began on the 22nd of November this year and is expected to last until the 1st of December 2018. Some LGAs in Kebbi State that were not covered during the second phase of the campaign will also be covered during this third preventive mass campaign. Distinguished ladies and gentlemen, I'm sure you are privy to the recent report from Edo State about a fever of unknown origin that is being investigated. Tests done in laboratories have shown that 9 of the samples tested positive for yellow fever, and as such, samples have been forwarded to Dakar for confirmation. In order to quickly respond to the outbreak, the National Primary Healthcare Development Agency the Nigeria Center for Disease Control, NCDC, the Edo State Epidemiology Team, the World Health Organization, and other international development partners are working together to rapidly conduct a comprehensive investigation and respond appropriately to the situation on ground. We would like to reassure the general public that all the agencies involved are working round the clock to contain the spread and prevent further outbreaks. The federal government, through